The Federal Ministry of Health, in collaboration with Plan International, GS1 and MSI Nigeria, organized a 5-day workshop to review the version 2019 National Health Management Information System 2. However, the participants had to discuss the relevance and importance of data and data capturing and balancing data in order to make changes in our society.
Progress and to report on what you are doing and to track whatever it is you're doing, you need quality data. Therefore, it's important that we keep an eye on our data to ensure that the reporting is on time, it is reported completely, and it is an accurate data. But beyond that, you need to have the right set of indicators. If you have the wrong indicator, there is no way you can measure progress. I'll give you an example. Somebody wants to reduce incidence and prevalence of blindness, and then he puts indicator, number of blind people that are rehabilitated. Now, that indicator, for example, cannot measure incidence of blindness. And so, because the people are already blind, the ones who are rehabilitating are blind. So how does that one reflect whether you are reducing blindness? So the point there is we need to have the right kind of indicators. And to have the right kind of indicators, you need to have the right data elements. The minister relies on the ministry, the Department of Health Planning, Research and Statistics, and particularly the NHMIs, to have the data that he needs to report to the new president. 2 weeks ago, we reported to the president on his deliverables. Some of the key deliverables. The overall goal is to crash maternal mortality and reduce under 5 mortality. But in between, we have the process indicators that will lead us to that. For example, antenatal care visits, skilled bed attendants. What proportion of our deliveries are happening with skilled bed attendants? We want to know immunization status. How many children are? I will please see this as a national assignment and commitment. Let us argue. I like it when people argue. Do not be afraid to argue. And the reason is, as long as they are constructive arguments, when we argue to agree, we bring out the best. But when somebody speaks and because we are afraid or we don't want to oppose the person, you don't get the best. So I always encourage us to have discussions. Let's subject every proposal to serious criticism and come out with the right result. I also need to thank our partners who are supporting this process, who are participating in this process. But I also want to appeal to all these partners, to all our partners, that we look beyond our areas of interest, but look at the big picture, the national picture, as it affects our final objective. Because we are all connected one way or the other. If you are working in the sphere of child health, some of your activities will be impacted on maternal health. The same way some of your own will impact on maternal health. If you are working in the area of data, your activities will impact. If you are working in infectious diseases, your activities will impact. And so we are all interconnected. I urge all of us to look at it from the big picture. And thank you very much. I wish you very happy celebration.
To be a part of this 5-day review of the Health Management Information Systems 2. Plan, like you will know, is we're an international 5 years in over 80 countries. And as a national entity, we have worked in Nigeria for the past 10 years. We are very glad to be here to support this workshop. From 2016, we have been part of this process because we understand how important data is to planning Without data, we'll all be working in space. We won't understand what we are doing. It's not, I'm sure many of us are privy to the fact that in Nigeria, of the about 18 million girls that are out of school, children that are out of school, 60% are girls. We have over, we have the third largest number of child bride in the world. Where did we get all of this from? It's from data. And so it's really important that we review our tools, ensure that it captures the relevant things it should capture so that we're impactful. Recently, we have heard of what is happening in Niger State, or what is about to happen in Niger State, where 100 girls are going to be married off. Who are these girls? What's their status? What's the implication? In terms of health, many of us here are health professionals. I'm sure you know that young girls that are married off at a very early age have a higher percentage or probability of having obstetric fistula. And so we're having young girls that are going to be exposed again to this. And so for us in plan, not just the young girls, the children that are born, that this keeps perpetuating intergenerational poverty. It makes us sad that this kind of things happen. And so that's one of the reasons why we support this and support it wholeheartedly. Because we know that with that data, as an organization that focus on children's rights and especially equality for girls, we'll be able to use those data to advocate for the rights of children, to advocate for changes in the health sector. So I want to thank all of us on behalf of the country director, promise our support, thank all our partners, MSI, JSI, Global Affairs Canada. Thank you for doing this. And I know that it's not a jamboree. Many of us have things we would have done. So I believe that these 5 days, at the end of the day, we'll have tools that we'll be able to use to make changes in Nigeria. Thank you. I wish us the best.
National level. We've been involved in data generation and data utilization at all levels. So for us, we are happy to be part of this. We actually continue to support and to align ourselves with all the process. I think similar process have already been started where we participated in larger through to the ones that were actually meant in developing a lot of data elements that may help in the intervention. And as IHP, we also want to share during the process with a lot of data elements that we found to be actually both troublesome or programmatic. So we believe at the end of the day, we're going to have a better tool that can actually inform policy making and programming in this country. Thank you.
Support organization. The review meeting is actually spearheaded by the Federal Ministry of Health, and it is something that's done every 2 years to come to speak with what is happening globally. We know that there are lots of things that change, new infections come in, new diseases, new things come up. And so it only makes sense for an organization to keep reviewing its processes to be in tandem with what is available, acceptable globally. So for us as Plan International in Nigeria, ours is just to support because we understand the importance of data and adequate data capture to the work that we do. We are mainly an influencing organization, an organization that is into advocacy, things that have to do with children and especially girls. And the only way we can make impact is if we have adequate data. We cannot be speaking to government without having data to back it up. So that is why Plan is so supporting the Federal Ministry of Health to review the tool that we have for the
So talking about
not actually fine. In some you will find, like I was saying today, who knows the impact of the 100 girls that are about to be married off in Niger State? What can we say about the state of the girls in a particular location in Nigeria? We don't have those up-to-date data, and for us that is something that's very important because harmful social norms hide and thrive when we don't have enough data to back it up. We have been talking.
Okay, go ahead.
My name is Wadiola Jagade. I'm the head of planning, data evaluation.
organization as the National Institute for Pharmaceutical Research and Development, which is an arm of the Ministry of Health. Consider relevant data that can be used in strategic calls.
Recommends that these tools should be reviewed every 2 years. But there are also challenges to that. Because 2 years is, we've come to notice that it's too short a period that is reviewing the routines. But when you review the tool, you also have to pilot, and then you also supposed to train health workers on the use of this. So 2 years is becoming too short, and then when we revise the policies, including recommendations